Continuing coverage tonight, we brought you this as breaking news right here at 7 o'clock. Last night, people possibly exposed to measles at DIA earlier on this month.
Right now, health workers are trying to contact anyone who may have come in contact with that person.
And the city and state health department is focusing on people who were on the flight with that person who was sick, as well as anyone who may have stayed at the same hotel.
Vicente Arenas is on it tonight.
We've been talking to healthcare professionals today, doctors today, and one of the recurring themes that we keep hearing is that if you are a vaccinated person, you don't have much to worry about. It is the unvaccinated people that need to be on the lookout.
People who were at DIA and at an airport hotel on May 13th and 14th are being told they could have been exposed to the highly contagious measles virus. A passenger who went through the airport's international gates tested positive for the virus. Because that virus can linger in the air for up to 2 hours, passengers and hotel guests are being told to watch for symptoms.
I think the main thing to know about is that if you are a vaccinated person, then you are safe by and large. For unvaccinated people, you should be monitoring for symptoms if you are in the vicinity of that exposure during that time period.
DDPHE says health workers are trying to contact people who are on the flight with the infected passenger. The same is true for people who stayed at the Quality Inn & Suites Denver International Airport Hotel.
As we're working with the hotel, we're able to get in contact with people who were staying at the hotel or who are working at the hotel at the same time they might have been exposed, and letting them know of the exposure, symptoms to look out for.
HCA Health One Dr. Katie Sprinkle says the measles vaccine is 97% effective. Dr. Sprinkle was at DIA with her child on one of the same days as the infected traveler.
You know, it made me think. I do have a young child who's had one vaccine but not two, so it did prompt me to call my pediatrician, and in my case there's nothing to do, we're fine. But it is something that certainly kind of raises the hair on my neck and made me think twice and get in touch with our pediatrician.
And that is a big piece of advice from Dr. Sprinkle. She says if someone feels like they might have been exposed and they're experiencing symptoms, they should contact their healthcare professional. In downtown Denver, Vicente Arenas, 2 Prime News.